Hello, and thank you for joining today's webinar on the importance of accessing healthcare data during a pandemic. First, let's get some logistical elements out of the way. This call will be in view-only mode, which means that we are super excited to hear from the audience and would encourage you to give us any feedback or questions in the panel below. We'll also be breaking up the Q&A for this session into two parts. There'll be a section in the middle and at the end of this presentation. This session is also being recorded and will be available for sharing or for watching when you would like. Today's presenters include Ricky Sahu from OneUp Health and Kristen Valdez from BeWell Connected Health. Ricky is the CEO and founder of OneUp and is using his diverse background to solve healthcare's challenging issue of data sharing and empowering healthcare innovators to ship quicker. Kristen is the CEO and founder of BeWell Connected Health and a transformative force in today's healthcare marketplace, spearheading the conversation on how empowering consumers can transform healthcare delivery and inspire loyalty and to reduce avoidable disease. Ricky and Kristen, thank you so much for joining today.
Thanks for having us. Thanks a lot. Yeah, we're definitely looking forward to this. Kristen, do you want to kick it off from your side?
Yeah, absolutely. The agenda that we're going to cover today is we're going to do a quick little overview on who we are, both at BeWell and OneUp, so that you know where Ricky and I are coming from. Talk a little bit about the regulatory environment and specifically what's changed now that we've been hit with the COVID-19 pandemic. We're going to talk a lot about where we are with data from a country perspective and data sharing and some of the new and emerging standards that organizations like OneUp Health are leading in. We're going to talk about how all of this data can come together to enhance consumer communications in not only now, but in a post-COVID world where it's becoming increasingly necessary, and how we can now start to come together as one healthcare delivery system working across stakeholders and making sure that we can deliver the experience consumers need and demand from us as we move into this new post-COVID world. So Ricky, why don't you go ahead and start by giving a little introduction on OneUp?
Yeah, sure. So hey guys, I'm Ricky Sahu. I'm the CEO of OneUp. And Christine, can we move to the next slide? We're helping people connect with their medical records across health systems in the United States. And we are working with thousands of organizations to connect with app developers. And Christina, do you think you can move to the OneUp slide?
This is the OneUp slide.
Okay, maybe it's just not coming in on my. Okay, there we go. So sorry about that, guys. So yeah, we're connected with 10,000 health systems across the U.S. We have about 600 app developers using our APIs and are definitely seeing a lot of usage out of this space where FHIR is now becoming the lingua franca to connect electronic health records. And the way that we got into this space was working with the Argonaut project early on to connect with the various EHR vendors and the US government. And we really saw that FHIR data was becoming regulated, but it still required organizations to do a lot of work in order to make it useful and in order to build those relationships with the health systems and healthcare providers. So we wanted to make a very easy on-ramp to connect to these health systems across the United States, and started engaging with the federal government as well as other organizations in space, providers, health plans, et cetera, and have won a bunch of government awards during the time frame. And now we're working with the likes of Mass Mutual, Boston Children's, Vertex, and some of the largest health plans in the US to support their FHIR-related efforts. Really what we think our mission is to make it easier for organizations to build on top of this data and the technology and connectivity is all part of that. And we're happy to be kind of working in this space with the BeWell folks as well.
Great, thanks. So I'll give a little quick intro on BeWell. BeWell was, when we think about the problems that exist from a consumer perspective in healthcare, is that as healthcare raced towards digital, and we'll all admit that it was a little bit slow, that every individual stakeholder had created their own experience for consumers. And so consumers are now faced with a situation where they have logins and portals and passwords to every doctor and every hospital and every lab, radiologist that they see. They have some passwords for all their insurance, which is still changing every 2.5 years in this country, largely not by their own choice. As employers have gone more self-funded and have become the fiduciary responsible for paying for the healthcare services for the populations, they're now piecemealing together anywhere from 7 to 21 different disparate health and wellness programs. We created high deductible plans like flex spending accounts and health savings accounts and supports financially for employees. And now retail pharmacies are getting more and more into the front line of health, where they're not only serving as pharmacies for drug distribution, but they're also doing things like hearing and vision, moving into primary care, and in many cases have clinics right on site. And then, of course, let's not forget the more than 500,000 digital health applications that exist in the cloud. Everything from remote patient monitoring to fitness applications, weight loss programs. And so, quite frankly, it's impossible for consumers to manage their healthcare. The most important part about this also is that in our country, 86% of healthcare decisions are made by women. We tend to caregive to children, sometimes spouses, but now more often also to our parents who are living generationally 25 years longer than the generation prior. And that means in my own life, I have this chaos times 7. I have 3 children, a spouse, 2 parents, and a sibling, all who I'm the health advocate for. And so it's impossible for us to manage our healthcare. So BeWell was created, if you move to the next slide, to talk about that and change the way that consumers interact with the healthcare delivery system. You can ask any room full of people in any setting where they go to manage their healthcare all in one place. And they don't really have an answer for you. And that's because of the fragmentation we just showed you. So BeWell's purpose is we are actually a B2B business. Our purpose is to work with employers, payers, and health systems and retail pharmacies to help them with digital transformation strategy with embedded consumerism in mind, making it easy to create a seamless, frictionless experience for consumers, but at the same time, bring the services that they offer to the populations they serve out to market, helping them not to have to build another individualized program, but being able to take advantage of interoperability and aggregation services. And we'll get into why that's important as we talk through data here coming shortly. So we're going to talk about the regulatory responses and updates that have occurred, specifically as they are related to COVID-19, and some of the things that kind of happened during that transition period as we all moved from being at work into being at home. So let's face it, we are now faced with a brand new reality. Consumers and employees who normally would go into the office and handle social out in public have now been home, and everything has moved to virtual and digital. That impacts a lot of things, including healthcare. And so as we look to the regulations that have changed, there's been a lot of key advancements, not only in consumer data liberation, and I think Ricky would agree that we like to call these the sentinel rules that most people didn't see coming that have changed healthcare forever. They're important because when we think about the regulatory landscape, we touch not only data with ONC and CMS's interoperability and information blocking rules, which in their shortest form mean that consumers, just like me, just like you, now have the right to access and collect our health records through any trusted third-party application of our choice. Now, the way that consumers used to, or I would say the way that businesses have always operated is under this, black box of HIPAA. And HIPAA basically means that there's a business associate arrangement where businesses can enter into a legal agreement and share information. These rules have actually changed everything. What they now do is they allow consumers to invoke what they call their HIPAA patient right of access. They have the ability to have a trusted third party like OneUp Health or BeWell or many other folks like even Apple to be able to pull their data down through an open API on their behalf. And so this is actually the first time in history that federal legislation was put in place dictating the actual technology standard to be utilized. And that's really cool because that helps from a standardization perspective. And in a few minutes, Ricky's going to walk you through some of the really cool architectures that can now be created. Actually, let's go back one more just for a sec through the architectures. But the most important thing I want to point out for this is two key things. One is that there are no legal agreements for a consumer to say, I want access to my data. So you are now entitled to get your payer data and your medical record data without entities having to sign into complex business associate agreements. No legal staff has to be involved here. But also, there's a big misconception that third-party applications that collect information and serve consumers with healthcare experiences like BeWell and many others, that they're not regulated. And the reality is that that's not true. We are regulated from the FTC. So we are obligated to have private policies and making sure that we have terms of service that are crystal clear for consumers, making sure that we can help them understand when organizations, what the use of that data is, what the retention policies of the data are, and our promises to users. So we'll talk a little bit more about where you can get information, including a website that OneUp Health helped to work with the Karen Alliance to pull up so that all third-party applications can register and let you know what kinds of data they collect, what their agreements are, whether they've attested to something called the Karen Code of Conduct that we'll get into in a few minutes. That really helps consumers know who to trust and whether applications are going to leverage their data on the back end and have the right to access that data or sell that data or advertise to users based on that data. At BeWell, we don't do those things. But it's important that consumers enter into a relationship with an application, understanding right up front what they're getting into, because we need to build trust. So as we move forward, let's talk about data for a minute. And I think Ricky also can jump right in here, that historically, when you look at healthcare stakeholders and all of the analytics platforms and all the systems that we use, healthcare data has historically been very, very siloed, where all of our healthcare entities have either been restricted to either medical claims and financial data to do an analytics on a population or electronic medical records. So what's interesting is that the world has evolved rapidly. And so our need to look at healthcare differently for consumers has also changed rapidly. So looking at not just one siloed data set where no one stakeholder has a complete 360-degree view of an individual, to one where consumers have the right to create that 360-degree view and share that information with whomever they choose. Some of those data sets that are super important are things like not just our medical records and our medical claim data, but being able to access data from, if you're part of the Veterans Administration or part of Medicare, where both entities have made data available through open API standards direct to consumers who receive care. But also things like wearables and sensors, right? Fitbits and Apple Watches, blood pressure cuffs, glucometers, asthma, Bluetooth-enabled asthma inhalers, things that involve our health when we're outside the doctor's office or receiving care, but prescriptions, biometrics, our labs, and now more importantly, social determinants, things that impact our lifestyle, things that impact whether or not we can even afford the medications our doctors are prescribing. And now with COVID, whether or not we have a place in the home where if we are symptomatic, we can isolate from our families. And because of COVID, we've seen a ton of changes in data. And that's because of the regulatory environment that did a couple of key things. One, pharmacists are allowed to do diagnostic testing for COVID. So in that respect, what that means is that if you drive up through a CVS or a Walgreens and you're getting your COVID test, is that there's now diagnostic data that isn't sitting in a payer provider or a provider environment, which are subject to these rules from an API perspective. So while FHIR is phenomenal and these rules are a great first step, we're not quite there yet. Labs have also changed. When you look at the emergency use authorization for COVID, we're now seeing where organizations like LabCorp and Quest have the ability for consumers to walk in and ask for a diagnostic test or an antibody test. Organizations like Everlywell, who've been approved for home collection tests, so that users can order a test from the comfort of their own home in order to get screened for COVID without having to leave their home. But what this does is, because of these changes in regulations, is it changes where a lot of the data sits. And you've heard a lot on the news about having to get information to public health organizations for very important things like contact tracing. So there's still a lot of opportunity as we're making more conveniences available for consumers and for employers to send their employees to, that we still need to make sure we're connecting to those data sets, and that in real time, we're able to not only access them, but we're able to get them to all the places that they need to. So I'm going to touch a little bit on FHIR, and then we'll turn it over to Ricky to talk about how OneUp is solving this problem for organizations like BeWell and for health systems and for many others. But let's talk about FHIR. FHIR is definitely something that's in its infancy, and I think Ricky can jump in here and help me with this one. But when we look at the FHIR endpoints, there's really only a handful of them, if you click on the next slide, that are actually in use today. And endpoints you can think of just basically as files that contain fields of information relevant to be shared. So while we're in our infancy, I've highlighted those that are most widely used today, and implementation guides are certainly being created at record pace. But there's also data sets, like we talked about, social determinants, and things like, dental and PBM claims and referrals that are not yet even created in terms of a FHIR standard or voted on or have those implementation guides. So we still have a lot of work to do. Ricky, I don't know if you want to jump in here and talk a little bit about.
Yeah, I totally agree. And I think that, like Kristen's saying, there are actually hundreds of FHIR resources available, or 100 plus FHIR resources available per version type. And very few have started to be implemented, these about 15 to 20. And, on top of that, their interactions are read-only. So there is a lot of potential in the space with connecting external data, like Kristen's talking about, from other systems, whether it's sensors, pharmacies, medications, et cetera, that could feed data at the health system and build this holistic care, as well as, data created in apps like BeWell or other questionnaires that patients may fill out in their, on their mobile phones. So the interesting thing is that we're just getting started, and read access to a handful of resources is getting us pretty far, but there's a lot of more opportunity around the corner.
Absolutely. And if we go to the next slide, I think you'll have a lot to say on this one as well. When we talk about the opportunity, it's not just the accessibility of the data from a pull perspective, but it's sometimes the operational way that we're deploying this across the country. This is a new standard for health systems and for payers. But still, it requires, one of my favorite things as we work with our consumers to go out and get records on their behalf. Consumers are obligated to have a portal account, whether it's at the insurance carrier or it's at the doctor that they see, in order for us to pull that information. And it's really important for identity matching. And identity matching is and can be a challenge across the board. But we also know that portal utilization is very low, right? Because portals have not largely been used as a complete and comprehensive digital strategy. They're really about a consumer's interaction with that individual doctor that they're seeing or with that insurance company. So a lot of folks go without ever downloading or creating a portal account. So in order for us to say, hey, BeWell, I want you to go get all of my records for me, we still need to ask for users, if they have 10 different doctors, to create 10 different portal accounts. And this is challenging because a lot of consumers get frustrated because HIPAA has been deployed, I would say, not consistently across the country. And many providers and front office staff don't really understand a lot of the critical legal provisions of HIPAA, where users should be enabled and entitled to access data without any special effort. And what that means is that when a hospital or a doctor says, hey, you have to come in person in order to set up your account, or we need you to make an appointment in order for us to grant you access, that while those things are not supported by the rules of HIPAA that are implemented today, they are actually in practice quite a bit. And so that creates some challenges for accessibility. And then also when we think about the work that OneUp has done, which is making this easier for the entire country to access, is that there's not always a human being at a facility or at a doctor's office that is the right point of contact to turn on FHIR for third-party applications that are trusted. So you have to go provider by provider in many cases, depending on the electronic medical record system that they're using, in order to be able to ask for permission to gain access to that API. And while there's requirements and timelines in place, sometimes it can be hard to actually find that human being. So Ricky, I don't know if you want to talk about the great work you all have done to establish the amount of connections you have, and how you feel these challenges have been, you've been successful where a lot of others have not been.
Yes. So we basically got connected to a bunch of these organizations because we helped them attest to meeting these requirements. And also helped them test their APIs and make sure that the data that they were, sending to apps was meeting the requirements of the regulations and was standardized as FHIR, and that, our app as well as others could interact with it. But I think that there have been numerous cases where, we, and I'm sure you as well as others, have reached out to health systems, even with patients that are at those health systems requesting access, and basically have, kind of hit a wall. And the new rules from the Cures Act, especially the ONC side of it, are promoting, anti-data blocking as well as open access and responses to app developers that I think is going to open this up to even more organizations. And I think where we're still sitting is that we, even after getting connections to those health systems, there are variations and nuances with the data that still are requiring technical fixes on the developer's part, which we fixed on our side so that third-party developers don't have to deal with cleaning that up themselves.
Yeah, and Ricky, I'm hoping you can also talk about another hot topic that we have been encountering, and I'm sure you have as well, which is, of course, our providers are really interested in letting consumers know when some application has requested access to their account. And so a lot of times when people use OneUp Health as a way to connect data for third-party applications that provide a service outside of just data collection, that each time a connection is made, emails are sent from providers and from payers to those individual recipients. And sometimes that can be confusing. So let's just say BeWell was partnered with, OneUp for some of our connections. Would it be that the consumer might receive an email from, let's say, Johns Hopkins or, Mercy or MedStar or one of the other big facilities saying, hey, OneUp you've made a new, established connection with OneUp Health. How are third-party applications supposed to work with organizations like yours without confusing the consumer? Because obviously our health data is super private, and we're going to talk about that.
Yes. So basically, there's two ways to do this. One is the app can introduce OneUp in their terms of service or privacy policy to the customer, saying that they interact with us to get access to their medical records, in which case the consumer will be, more aware that OneUp is being used as a third party to support this sort of interaction. And the other way is we can work with you via your credentials to connect to these records. So your client ID and for various health systems. And support you directly as a managed approach. And we're doing that with other organizations as well. So, we're not trying to hide behind something. We want to make sure that the consumer is fully in the mix, because I totally agree that they need to be. But we also have options for, if you want to own that branding fully, that we can connect as a back-end service, similar to like Amazon Web Services or another, back-end provider that ultimately does connect with your data, but is a steward of the data that is supporting the app.
That's amazing, Ricky. And I think that's good for people to know, because these are the kinds of details that, as people are thinking about either becoming hybrid organizations where they work both within HIPAA and outside of HIPAA under the new patient right of access, that that they have partners that can be helpful to them to both maintain, their identity, but also, and more importantly, not confuse consumers with this really private information. I think we've got a question for you that we're going to break. So, Nisha, if you want to let us know what that question is, we'd be happy to answer it.
Yeah, absolutely. And they're related to exactly where we were going here. And so Vilma wants to know, our company is working on a similar solution, and she's very excited to be here and hope to work together in the future. How do you handle duplications of healthcare data via multiple FHIR feeds?
So I can answer first, and I think, Kristen, maybe it makes sense for you to say how you're doing it on the application side. But as a platform organization on the OneUp side, we are not actually removing duplicate data, because there may be a benefit, depending on the application, to have that duplicate information. So you may not want to merge in some automated fashion the members' demographics from two different health systems, because one address is actually accurate and the other is not. And that might be something that the application should handle. Or you may want to know that, this provider at health system A has prescribed this patient a certain medication, and another provider at health system B has created a medication statement saying that the patient is on that medication. Because if they hadn't, then you may want to notify that other provider that, the patient is on this medication from this other health system. So depending on the use case, you may want to deduplicate it, or you may want to keep those dupes. And I'm curious, Kristen, how are you guys handling it on your side, and what is the use case to do one or the other from your perspective?
Yeah, and Ricky, you're exactly right. And we handle things almost identically. It's our job to showcase to consumers what their data actually shows. And I think what we found is interesting is that the first time consumers see their medical records, sometimes they see a lot of errors. My own daughter has an enlarged prostate, according to one of her health systems. So we know that there are some things that go on, but we make sure that we not only transparently showcase to consumers all of the information from all of the sources, but we give them the ability to indicate in their own accounts, what is accurate and what is not. Now, there's no current way from an automation standpoint, although HIPAA grants the right for consumers to update their records, there's no automated way that we can push that information back. Although I think that's something the industry is going to be working on pretty heavily here over the next few years. But at BeWell, we ingest data from clinical providers, but also from payers and wearables and sensors and labs and pharmacies. We get a lot of duplication. So BeWell has taken an approach of something that we have deemed what we call the golden record. And so we use and combine into a standard unified format all of the data that comes in. We establish where data points are the same, and then we establish where they're different. We showcase those all to the user and give them the opportunity to let us know in their consolidated record that these things are not accurate. Like, I'm no longer taking this medication or others. We do work with the providers that we serve to make sure that they have that updated information with, of course, consumer consent. So the golden record is really something that we have built out across those data sets that I think is going to be essential for how consumers can cleanly see this data. But I agree with you completely, Ricky, on the need to be transparent and showcase what comes in and not transform it before consumers see it. And I think we have another question.
We do. So Jay is interested in knowing, so regarding users having to create or manage multiple portals, a couple of months ago, the Karen Alliance was talking about developing a single federated identity or login. Any idea what Karen's plan is?
Sure. So I would say that Karen is actively at work working on this federated ID, and it's specifically to solve for the problem that we talked about. And both Ricky and I are members of the Karen Alliance. But the problem is really having to require multiple portal and user accounts. So while Karen is working on that, we're still a ways off, not only from having a full plan, but then to get buy-off from the entire country, that we can implement and deploy this across all of those different disparate systems. But the goal here in mind is that consumers can have that one identity, or that we can take an identity approach underneath a global and more, I would say it's moving towards global, but right now a national framework where consumers can have one ID that would then allow them to go into multiple systems without having to have different portal identifiers. We are not there yet. And I think it's going to take probably a couple more years before we can get there. But Ricky, I don't know if you have any thoughts on that.
Yeah, I think it definitely will take some time. I mean, you have to essentially convince the major, EHR players, as well as other large organizations like the health plans that are going to be implementing this soon, to support this. And that's both a political or issue as well as a technology issue. So it will take some time. I think in the meantime, there are a few other ways to approach it. So when you sign up with a patient portal on Epic, there are ways that Epic and other vendors have automated this, essentially using what's kind of like a zero knowledge proof, where you say, it's an Experian-like approach where you say, these are the last X addresses that I've lived at. Here's my name. Here's my birth date. Here's, part of my social, et cetera, that then the EHR can use to verify, and authenticate you are who you say you are. So that is not requiring you to have a patient portal already created, or a username and password set up, but it is still getting the same level of security in terms of, validating your access. So you could think of similar zero knowledge proofs, where you ask about part of the record, and if you already know, this part of the record, then it's likely that the rest of the record too, and you have the right to access that. So that's one way. Another way is going off of the password and account and going to a more email and phone-based approach, which would allow you to, as long as the email or phone is tied to your record, you could send a code, like a two-factor type of code, to your email or phone number, and then tie that to and then use that as a validation that you own the account. So there are a few other ways that I think in the short term can attack this. And I know the Commonwealth Care Quality groups, they do some of the zero knowledge proof type of things already, as well as other health systems that are involved in HIEs. So this is not dissimilar from that.
That's right. No, I think that's great. And that's actually a nice segue into the next topic we're going to talk about, which is the consumer mindset shift. During the time that healthcare was really moving towards digital and mobile, consumers also moved into a more digital and mobile environment across the board. Everything from their shopping to transportation to weather and news, their social, and have become more increasingly aware and skeptical from a privacy perspective. And so consumers really demand transparency. They demand privacy. And we saw that very clearly with a couple of examples. It started very, publicly with the Facebook Cambridge Analytica scandal, but then it moved into healthcare with agreements like the Ascension and Google relationship for machine learning and data science practices that were covered under the HIPAA umbrella, but that consumers really didn't appreciate because of what we call the black box of HIPAA. So while business associate arrangements may allow for certain types of data sharing to advance healthcare forward from healthcare stakeholders to tech companies and back again, consumers really want and demand transparency. We saw the power of the consumer in healthcare in another way when we saw the price gouging that occurred with the EpiPen, right? And consumers did not want to stand for that. And as a result, things changed. So as more data flows and consumers have more access, they're going to have a lot more control and power to be able to say what they want and what they don't. We saw some amazing transformation in telehealth and telehealth rules as a result of COVID. So consumers now have been able to access telehealth at unprecedented levels, and providers are now being a couple of key things. One is that they're being paid at the same rate that they would be in person to perform a virtual visit. And they also have now been able to practice at the top of their license across state lines, which is important for things like COVID. So if, New York is a hotspot, but COVID hasn't hit the middle of the country, there are a lot of phenomenal physicians and specialists that could be made available to aid the overburdened healthcare system by doing telehealth and telemedicine visits to keep people with chronic conditions monitored, to make sure that people are still getting their preventative care and their screenings, and making sure that they have access to a doctor when they need one. But privacy and security is really important. And so consumers also need to know which apps to trust. So on the next, I'm hoping you can talk your work with the Karen Alliance and My Health application.
Yeah, so the Karen Alliance is definitely, pushing this market forward with a lot of transparency for customers, and I think, and patients. And I think one of the biggest spaces that were lacking here was the knowledge or insight into what applications are available for customers and which ones can connect to their healthcare records in a reliable manner. So what we were doing with the Karen Alliance is we, built the My Health application website to showcase apps that are connected to patient records across these various health systems in the U.S. And this is just getting started. So there will be many more applications that are listed. And right now, these are apps that are connected to providers, but soon there will also be apps that are connected to health plans as the new regs from CMS take hold in January to July of next year. And we'll talk about a little bit more of that soon. But this is meant to be a place where patients can learn about all the apps that may be beneficial to their own personal, concerns or medical issues or health systems that they are interacting with.
That's great. And I know everyone really appreciates your efforts to support Karen in this. So it gives people a place to go to know which applications have signed on to things like the Karen Code of Conduct, which if you haven't seen, I would encourage you to take a look because it does talk about the commitment of applications to really maintain that trust and privacy. So Ricky, I'm going to turn it over to you now to walk through a little bit more of OneUp, specifically indicating that health data sharing is happening. This is not just a pipe dream. We're no longer talking about when and how this will happen. It's happening. So take it away.
Yeah, totally. I mean, exactly like you said, this is happening already. BeWell is doing it. We're doing it. Hundreds of other apps are doing it. And these apps are doing all kinds of things for patients. And the big, shift here is that healthcare apps originally were very, very broad. They were usually just a PHR. But now, because this connectivity is far more available, there are applications being built for more specific use cases. So, patients or people that need to get life insurance. NPR has a story about how organizations are responding to COVID, and they mentioned how MassMutual is using us to get data for members that are, getting life insurance after the member authorizes access only. So what that means is a member that wants to get a life insurance plan, they can go to MassMutual, authorize access to their full medical record. We provide that, via their consent from the health system, and then MassMutual can continue to, participate in their business without the individual having to go in to see a doctor and get a, checkup when all their data may already be at a health system. And other health systems like Partners and Boston Children's are using us to connect to health data to pull in medical records from other health systems to support a full 360-degree view of their patient's record. This is definitely already happening, and the connectivity is pretty broad across the U.S. It's at this point, approximately 80 to 90% of the U.S. population, large health systems are already live, and this has been happening for the last 2 years now. So this is not just like a regional thing. It's not something that's happening with a few select players. This is broad access, and hundreds of apps are building on top of it, and it's really going to transform the way that the industry has been set up in the past, to kind of what Kristen was saying before, from this position where patients really haven't been in the mix with their data, to a position where patients are the ones that are controlling their records and may become the authoritative source onto what's accurate in their records. And rather than maybe getting data from health systems that may have part of the picture, it will shift to an environment where you ask the patient for their full medical record, and they are the entire picture. So yeah, the way that we're doing this today is basically there is a service that we have called Quick Connect, where consumers can enable access to their data literally in seconds. Basically, you can search for your health system and click on that, and then enter your patient portal credentials for that health system, and then authorize data access. And then once you're authorizing data access, we query the full patient record for that member, and then share that data with the app that the patient wanted to share with. And this is always opt-in. There's no behind the scenes data sharing that's happening without the patient's explicit consent. And the reason that we want to keep it that way is because, this is sensitive information. We want to make sure that whenever the patient shares this data, even though we are not bound by HIPAA under this patient-mediated authorization, we want to maintain the utmost trust with these members, and not have a Cambridge Analytica situation in healthcare, which we think would damage a lot of the work that's been done by the industry and by us and BeWell and others, and maintain utmost security and privacy for this data. So we won awards for the Privacy Policy Snapshot Challenge from the ONC, and there's a public privacy policy generator that other applications are using to demonstrate what they do with this data and how patients opt in and all that kind of stuff. And that's open source on GitHub. Feel free to jump in and use that yourselves. And we want to just make sure that everything is spelled out very clear to customers, and nothing is shared without their consent. Then there's also another process, which is the BAA process, which is Kristen mentioned, is kind of the way that Google and Ascension work together, and that's completely legal, but it did catch consumers off guard, because that is behind the scenes data sharing that's happening. But the thought is that Google was doing that to support clinical treatment and other operations for Ascension. So the BAA process is actually been around for since HIPAA, to support backend vendors or systems that operate on this data for or on behalf of the providers of the health systems. And it's a very important part of the process. Like, a lot of healthcare couldn't be done without it. But I do agree that there are, there's some more clarity or transparency that's needed in that space, to maybe list all the vendors or organizations that are interacting with the patient's record from the health system or other perspectives. And that's not something that is fully made available to patients today, but I think some of these regs are probably going to push in that direction.
And Ricky, a quick question on that. You mentioned earlier that this essentially falls outside of HIPAA. Can you expand a little bit more on what that means?
Yes. So basically, when a patient shares their medical record with a third-party app, because the provider is not directing them to do that, and because the patient is doing that for their own record, um, it technically does not fall under HIPAA. And it's basically like you telling a friend or someone else, part of your medical record. If you tell someone that, they are not required by law to keep that secret or to secure it, encrypted and all that stuff. But we understand that this is healthcare data, so we do store all of our data in a HIPAA compliant manner and treat it the same, regardless of the source. But technically, apps are being governed by the terms of service and privacy policies that Kristen had mentioned early on, and patients should only share their data with apps that they trust, and be aware that these apps are not bound by HIPAA and that they could legally share with a third party without the patient's consent, but bound by the terms of service governed under FTC, et cetera. So,
Ricky, I think
go ahead.
What's important for people to understand is that the idea of these rules and regulation was to create an innovation ecosystem where we could get a lot more applications out there. And I'll give a quick example to put this into perspective. I am a mother of 3 children, and every time they go to school or they play a sport, they have to fill out physical forms, vaccination proof forms, and all of those great things. So I can't tell you how many parents will say it is such a pain for me to have to send a form to the pediatrician, go pick up the form once it's filled out, pay a fee, and then drop it off at the school in order for my kids to do this. Because of course we have to do this during our working hours. So if an innovator comes up with an application that says, hey, I'm going to handle all of this for you parents out there of kids going to school and managing sports. When they collect data on our behalf from the doctors and the pediatricians and others for those records, and they transport them to the school nurse needs to keep them on record. We don't want the school nurse to have to be covered under a business associate arrangement with every single provider that is now passing that information through an application to the school, because we as parents are authorizing that connection to someone that we trust. So this enables an app ecosystem and innovation to move a lot faster in healthcare, where there's previously been a barrier because of HIPAA and business associate arrangements, provider by provider, system by system, and data holder by data holder. So we're really excited that this is going to move us forward significantly faster in innovation to provide what consumers really need, which is the simple button and a new front end to healthcare. So I know we're running kind of up on time and we have some questions, but if it's okay, Ricky, can we jump forward to the COVID work? Because I really want to talk about the importance of this.
Totally, let's do that. Actually, do you mind if I share one more thing, which I think, Christina, can we go back to the diagram?
Yeah.
So one really important thing that I want to reiterate is that there are new rules from CMS that are requiring health plans to make sure that they can share their full claims data set with patients the same way that these health systems are doing that. And I think that's super important to get across, because this is a whole set of medical records that are going to go live over the course of the next 6 to 12 months and make available, the similar use cases, but from the payer's perspective. And essentially it's a similar type of shift as what happened 10 years ago with meaningful use and the creation of the EHRs, but now it's taking place at the health plan. So that's going to create a much more consumer-facing relationship with health plans than has existed before.
Absolutely. All right, now let's talk COVID, because I don't know how many times COVID's come out of your mouth every day since this occurred, Ricky, but let's talk about how this data really impacts. First, I'm going to talk about the consumer side, and then I'm going to have Ricky talk about how this data can really help the industry as a whole. So let's just set the reminder, right? We are now in a world where consumers are going to have to toggle back and forth between virtual care and in-person care. And when we think about the flow of healthcare information and how it can actually transform not only consumers' ability to access care, but also their ability to get back to work safely, there's a couple of use cases that I'll walk you through. So on the next slide, we'll talk about some of the data that we can collect from consumers and then leverage in order to connect behind the scenes users to what they need in this time. So something as simple as you can receive a text message just saying, checking in before you go into work on a daily basis, as employers are thinking about how to safely get people to attest to the fact they're not sick. They can simply type in healthy, or sick. If they're sick or they're symptomatic, they can be linked into things like the CDC triage and symptom tracker, where we can take surveys that will help guide people as to whether or not they need to seek care, and then automatically connect them to a telehealth provider, where behind the scenes applications like BeWell and others can transmit data with consumer consent to the physician, as they may not know them already, who's going to be caring for them. So the doctor has all the information that they need around conditions that someone might be suffering from, medications they might already be taking to avoid any of those drug to drug or drug to disease interactions. And then if a medication is necessary and that physician decides that that's needed, again, making sure that we can create a consumer navigation experience where we can then connect them to who might be delivering scripts. A second one might be, well, I'm healthy, so I can go to work. Great. Well, when we think about employers, we want to keep that workplace safe. So each employer has instructions that they have been given by the EEOC and by their government and state and CDC in order to get back into work. So helping people understand, are masks required in the office? Are they not? What are the procedures for checking in? Do I have to stop and get my temperature taken, sanitize my hands, or even show a QR code that could be used in order to say, I've been tested recently and I'm not sick, where employers don't need to be exposed to that data. But then also being able to consolidate all of the point solutions that can be helpful for people, both businesses and consumers alike, around organizations that can serve them during this time, both digitally and in person or through delivery, or even employers with being able to outfit and change what is occurring in the physical office space, and making sure that they have adequate supplies of PPE. Or when people are home, making sure they can get tests, both in-person drive-through or in a facility. So moving on to how this can help businesses, Ricky, I'm hoping you might be able to touch upon how fire and bulk fire can be helpful, and all moving into e-case reporting. Oh, Ricky, you're on mute.
Thanks. Bulk fire is basically being used to connect to this patient data at the population level, and it's enabling a SQL environment on this so that you can do joins and aggregations and really reporting and analytics. So where this is interesting for COVID is that oftentimes you need to be able to understand how this is happening across the state, across the nation, or within your organization or health system. And you can actually query this data based on different coding terminologies and standards like ICD, et cetera, on COVID-related data. So I think that definitely gets interesting when you're reporting this back to other government agencies like the CDC. And their CDC is kicking off electronic case reporting, which can allow applications to be embedded in the EHR to get data back from the health system to report it to the state and to the CDC in a standardized manner. And that's something that we are also getting involved in.
That's amazing. Obviously, this data connectivity, had it been in place before COVID, could really have helped us with the accurate reporting up front, but it's great to hear that organizations like yours are getting involved. We're certainly getting involved with our health systems across multiple states in helping them to support employers getting back to work, and also making sure that they are working with public health on things like outbreak detection, managing the health of their population, and delivering virtual services. And of course, like you, are involved in contact tracing discussions as well. This data is so essential for making sure that consumers not only have privacy and transparency and have offered informed consent, but that we can help their data flow freely in order to serve them with what they need out of the healthcare system now more than ever. So I know we're at the top of the hour, and I'll turn it over to see if there are any questions for either Ricky or myself.
So with the release of the new ONC and CMS regulations, how do you guys think that they're essentially enabling things like, telehealth access and some of the other applications in terms of being able to address the COVID pandemic much rapidly or much more quicker?
Yeah, I can start there. I mean, I think the regulations in order to support telehealth were transformational. I mean, it was really 2 decades worth of advocacy on behalf of a lot of organizations that were updated in just weeks. I think one of the big questions we've been getting asked is, are these regulations going to get rolled back at any point? And I think, from my own opinion, is that the answer is no. You can't unring a bell, right? And consumers are now realizing the convenience of accessing their doctors virtually for everyday routine things that don't actually require an in-person visit. And I think doctors are also finding that it's very convenient for them to be able to service people virtually as well, even those who hadn't adopted telehealth before. So easing up on the restrictions for both technology, for physicians being able to practice over state lines and support one another, and being able to be compensated fairly is something that I'm hoping we don't see any backwards momentum for, because it's certainly something that has shown we can scale pretty rapidly as we've released a lot of those, the tightening of those regulations.
Yeah, no, I totally agree. I think that this is actually going to become a differentiator and build a better relationship between providers and patients and health plans and patients, and really be a way that they can expand what services the patients have available to them.
Well, I think that's all the time we have. I want to thank you all for spending time with us and joining us. If you have any questions, you can certainly reach Ricky or I. We're happy to connect with you to dive in. But thanks so much for your time today.
Thanks, guys.
Thank you. And thank you, Kristen and Ricky. We really appreciate your time today. As we mentioned, if you missed any part of this presentation, the good news is that it was recorded and will be available shortly. We appreciate everybody's time. Thank you for watching. Bye-bye.